everybody. It is Skin Cancer Awareness Month. I think it's also like Melanoma Awareness Month in May in the United States. And frankly, it should be globally because it really isn't just a certain kind of skin type or skin color that can get skin cancer. Anyone can get skin cancer no matter how light or dark your skin is and no matter your ethnicity or race. So I'm here with my mother, who's this phenomenal dermatologist and dermatopathologist, to help us understand some of the things we can do to stay safe. One of the things that I don't think is really popular, you don't see it talked about a lot, is mole mapping. So what is mole mapping?
Okay, mole mapping. Okay, that's a very good question, by the way. Mole mapping just means a patient comes to the clinic and wants us to examine the a certain mole, growth. One spot here, a spot there. And normally in my clinic, when I do that, I tell them, okay, since I'm going to be looking at this and that, and looking at the condition of your skin on the face, on the exposed areas, as well as the legs, I think it would be very important for me to actually also look at the other parts of your body, chest, back, to see if there are any growths similar to what you are, asking me to examine.
Okay, so if I'm hearing you right, if someone comes in to check on a mole, the advisable thing to do is to already look at other moles as well.
Right.
Or other lesions or spots.
Right.
Because sometimes early signs of skin cancer, it's not necessarily a mole. It can be another growth or another dark spot or something on different parts of the body.
That's right.
So when we say mole mapping, she's talking about, okay, I'll look at a mole that might be irregular in color, have a funny shape, be growing quickly, be of a certain size, etc., etc. The classic, I think it's A, B, C, D, E, right, that you look at for moles. But in addition, she'll then have you disrobe and check all the other moles that you have on your body. And of course, if there's something else that isn't a mole, but that should, be observed, she'll do that too.
There are many ways of doing mole mapping. There's, of course, the very sophisticated one where there's a real gadget and things like that the person stands in front of. What I do in my clinic is something really rather simple. I will have them strip. I'll start with the face, the scalp, the neck, and then go also into the trunk and the upper part of the body and lower part. Remembering that there are lesions like melanoma in particular, which doesn't necessarily just appear in the sun-exposed areas of the body. They can actually be hidden away in the anogenital portion of the body, or especially in people with brown skin, they can be in between the fingers or at the nail, and down there on the legs, it can be actually at the sole as well as with the nail in between.
So let me double down on that a little bit, folks, because I think that the dominant narrative for skin cancer is it's only for very pale white people or pale mixed people like me, and only for sun-exposed areas. So when you bake in the sun, and so you would think the neck, the ears, the scalp, the neck, the chest, etc., out on the beach or something. But what she's saying is so important to remember. A, it's not just very pale people. And B, it's not even just on sun-exposed areas. She mentioned the genital area. That's pretty hidden for most people. And she mentioned specifically the anogenital area, which is usually really uncommon to consider as a sun-exposed area. Although, did you hear that there was like a viral trend at one point to actually expose one's innards, inner genital area to the sun?
Oh, really?
For health, supposedly. So now you have it from an expert, folks. Don't do that. That skin is very thin and very sensitive, and it can be a source of skin cancer, so don't do that.
That's right.
Other sources, just to double down again on what she said, especially for browner people, skin cancer can appear as like a dot on your fingernail or something in between your fingers or your toes. And again, we tend to dismiss it because we're not constantly thinking skin cancer, right? And the problem with that is that then when it is caught, it's caught later.
Right.
and potentially more dangerous.
Right. The other thing that you must remember in skin cancers is that it can now, even melanoma has already been found in children. So, before we used to teach our patients that it takes 19 years. So if you were badly exposed when you were a baby, it'll be about when you're 16, 17, 18, like that, 19, before you will worry about it. But now, quite early on, we were aware about it and we examine patients well.
So
the other thing, besides that, children and the hidden areas, mucosal areas can also be a source for cancers. Leukoplakia, the thickening of the skin. So if you have anything there that also is kind of
looks a little
right, look at it, and during this time of teleconsultations, I always tell patients, send us pictures, even of hidden areas, so that we can really assess it well. And then when there's anything that's really problematic or questionable, I tell them, this time you have to come to the clinic.
Right. And then what they might do is, she is also a dermatopathologist, which means it's a subspecialty between dermatology and pathology. And they tend to work with your oncologist, with your dermatologist, to look at biopsies, to look at the slides under a microscope to see what the risk is, or to get a more accurate diagnosis. What is the difference between skin cancer screening and mole mapping?
Skin cancer screening and mole mapping is somewhat similar, actually. They're, because when we say mole mapping, we actually, when in real practice when the patient is examined, we're not just looking at the moles. There are many other growths, some of them due to the results of aging, like tiny little freckles, tiny little lentigens, the little
or white
persistent
spots.
Right. So those we examine well, and in addition to the looking for skin cancer.
So for the lay person, for your safety, potato, get something. A mole mapping or a skin cancer screening, but get it done. Especially if you tend to be outdoors. But like you heard, you don't even have to be a sunbaker to kind of get this. And crucially, no tanning beds. This is clear, please, folks. Bad idea. Okay, would you like to maybe do a mole map, a quick examination? This is a Dermascope that my mom loves to use, and it's really rather incredible because it helps to get a very detailed, zoomed in, hardcore photo of a mole or a lesion.
So this is I'll turn on the light, and you see that mole that's there. I put it right above the ruler. Right, so there.
And if we go close up, right?
Right.
I don't know if you guys can actually see that. That's my mole, which if you look at it just here with the naked eye, you can't see that detail. So it's pretty cool. And the nice thing about that is that can then go in a file, and so the next time you come for your annual checkup, you can see if it's grown or changed shape or become more of an issue.
Right.
But doctors might have different instruments. They might use a Dermascope or something else fancier or whatever. But even just an ocular check is better than nothing.
Right.
Okay.
Right.
So there is actually merit to seeing a dermatologist like you do your dentist or your gynecologist. Schedule it for once a year to check, just to be sure.
That's
right.
Right, because it's growing.
There you go. Thank you. Be safe, everyone.
That was pretty good.
Okay.
Bye-bye.
Bye.